A very good afternoon, ladies and gentlemen. Welcome to the 10th webinar of WWF India on One Health and One Planet, preventing the emergence of zoonotic diseases. I must say that this webinar is being organized at a very opportune time during the course of the ongoing COVID-19 pandemic. Why I say this? Because now we are having a fairly good idea about its both short-term as well as long-term, societal as well as economic impacts, and possibly what actions are required to be undertaken by various stakeholders. It is essentially for this reason that people and professionals in all sectors of our society are beginning to look for solutions for addressing the COVID-19 pandemic challenge and look beyond the what I call as business as usual scenario. There is a need for ushering in transformative changes using science-based hard evidence to reassess the relationships between people and nature, which is now being recognized by a very large section, if not all sections of society. You probably know which sections are missing from this, but a very large proportion is now understanding that these transformative changes are needed. People are also realizing that there is a need to reduce or minimize the global environmental changes that are caused by unsustainable consumption and which drive biodiversity loss, influences climate change, and ultimately leads to the emergence of pandemic. I must say that COVID-19 pandemic began as a health crisis almost a year ago. It was towards the end of December 2019. But today it has become the worst of human and economic crisis of a lifetime. Interestingly, all human occupations are affected, whether we talk of indigenous fisheries in Canada, or we talk of tourism in Africa, or we talk of farming in Brazil, to meat processing plants in the United States, and to our own migrant workers in India. So a huge section of society is affected and influenced by the pandemic. The global economic costs are estimated to run into trillions of dollars. And that's not the only thing in terms of economics. Over 1.5 billion students have been out of school for several months. And tens of millions of people are being pushed back into extreme poverty and hunger. So what I would say then, that COVID-19 is certainly not a natural disaster in the sense we hear about earthquakes or volcanoes or hurricanes. I live now in Chennai. Every other day I hear about a cyclone. It is more akin to a crisis that is engulfing the natural and social systems at a truly global scale, but with disastrous consequences for mankind. So therefore, it's very obvious that pandemics such as COVID-19 underscore both the interconnectedness of the planet and the rising threats posed by global inequality to the health, to the well-being, and to the security of the people. The COVID-19 also exemplifies that human actions that impair our natural capital are bound to have more serious and more frequent and probably more disastrous consequences for the mankind. It may be true that both mortality and morbidity due to COVID-19 may ultimately be higher in the developing countries due to the kind of economic constraints we face which affect our access to healthcare. But these changes are also going to affect the developed countries that depend on globalized economies. So the point is nobody is safe, whether you are part of the developing world or whether you are part of the developed world. And therefore, this is essentially the reason that we need to work together to organize ourselves, to reorganize ourselves, and to synergize ourselves to address what people are calling as the biggest catastrophic event since the World War II. But there are certain interesting things. The causative factors for these pandemics, I would say, are reasonably well understood. It's not that we know everything about it, but we know and we do understand the basic reasons for that. And the finger is towards unsustainable exploitation of the environment due to rapid land use changes, the agriculture expansion and the intensification which the world is witnessing. And we will hear more about it, about the wildlife trade and consumption from two of our colleagues here. And then there are other drivers that disrupt the natural interactions between wildlife and the microbes. And thereby, they are increasing the contact among wildlife, among livestock, people, and their pathogens, leading to the emergence of one pandemic after another. Now, as we try to look at the global effects or the effects on the global economy, I must say that we cannot accurately assess them now till the vaccines are fully developed and deployed and the transmission among populations is contained. But there are very reasonable guesses, I would say. The cost is being estimated between $8 to 16 trillion globally. And mind you, this is a huge figure by any standards. But I have all to say some more things, which is the subject matter of this discussion today. Our current pandemic preparedness, the strategies that we have, they aim to control these pandemics or the diseases after they emerge. Thus, our business as usual approach to pandemic is based on containment and control after a disease has emerged, and it relies primarily on reductionist approaches to vaccine and therapeutic development rather than reducing the drivers of pandemic risk and to prevent them before they emerge. So this is something which needs to change. And this has been a big learning for all of us. And therefore, this webinar today is a step in right direction. It is also true that pandemics often have unequal impacts on different countries and sections of the society. The elderly are affected differently, the women are affected differently, and obviously the underprivileged are the worst sufferers. And that is essentially the reason which we are going to discuss today, that pandemic control policies have to be transformative in nature. And all the recovery programs, and we will hear from two of our colleagues today, they have to be gender responsive and inclusive. And I'm stressing on the word inclusive because you understand that for a country as varied as India, unless we have an inclusive program, we will not be able to do much. Definitely, we are talking of a One Health approach that integrates the animal health, the domestic animal health, the human and environmental health, which is now being perceived as both a scientific approach and a pragmatic approach to be dealt by all concerned. But then here again, the challenges are of a different nature. Institutionalizing the One Health approach in government policies and programs, which help us to build the pandemic preparedness, enhance pandemic prevention programs, investigate and control outbreaks across sectors, are all very needed. And fortunately, we have a very nice panel today. I am very pleased to share that we have in a panel today 4 very eminent and experienced panelists who bring together a wealth of experience as a biologist, as a veterinary professional, as an animal husbandry expert, and of course, as a forestry professional. So these four panelists that we have, and I'll be shortly introducing them, are going to take us forward in responding to this larger picture that I have given before you, that what is the kind of preparedness, how do we need to work together, how do we synergize, how do we move ahead. The format of webinar is pretty simple. I'm sure most of you are attending them quite frequently. Initially, all the panelists or each panelist will be given some 8 to 10 minutes to put forth his or her views in the context of a discussion, and especially related to his or her domain expertise. As I said, we have people with different expertise or domain expertise, and they would be talking on the basis of their huge experience that they have gathered over the year. And all participants, and that's my request to the participants, kindly send your questions, comments, observations in the chat box as you hear our panelists speaking. You may like to direct your questions to a particular panelist, or you may just keep it generic. I leave it to you on that. And then once we have had the first round of the panelists, we have had some Q&A. Towards the end, we will have one more opportunity to hear our panelists one more time and to see that how they can summarize the discussions and give us some takeaways. Because attending a webinar is fine, everybody loves it, but at the end, one needs to answer and ask that what is the takeaway from that? How do I move ahead? So these were some of my initial remarks, and without losing time, I want to move ahead. And I would like to introduce my first panelist, who is none other than the very experienced Dr. David Olson. Dr. David Olson has over 3 decades of experience working as a conservation biologist. And mind you, he has worked in not 1, 2, 3, or 4 countries. He has experience coming from 50 countries across 5 biogeographical regions. So that is the real experience that we would have, and we will hear him in a while. He is presently the Director of Conservation in WWF Hong Kong, and is tackling a large number of issues leading to the wildlife trade, and also looking at resilient flyways for migratory birds. And as an academician, he holds a PhD in zoology from the University of California in Davis. So David, with all this wide experience that you have, and I will definitely give you an opportunity from now, but I am a little curious to ask you a few things which you would like to cover in your intervention. That what are these actions that our global society needs to take, which can help to significantly diminish the risk of serious emerging infectious disease, as we call them, or emerging or re-emerging, also we call them. And then you need to explain to us that how is that the wildlife trade is degrading the natural ecosystems, and what kind of risk that the future zoonotic diseases that might have. So these are some of my questions based on your vast experience, and I will hand it over to you for your 8 to 10 minutes of intervention. So over to you, David, and thank you for accepting our invitation. Thank you.
Well, thank you very much. I appreciate the opportunity to talk to all of you today about these very salient issues. As I was asked, I'm going to try to talk about the global perspective on this, more so than a focus just on India. As humans increasingly dominate the planet, we are putting into place certain situations that are conducive to an increased risk of emerging diseases, serious emerging diseases. And what I'd like to do is just describe what are some of these features that are driving the elevated risk that we're now facing. This recent pandemic, if you go back through the literature over the last few decades, there have been warnings from virologists, epidemiologists, conservationists that an emerging infectious disease there was a high potential for one to break out into human populations based upon what they were observing in the wildlife trade and in the alteration of natural environments. So among that group, this recent pandemic was something that they predicted and was taken seriously in some sectors, but clearly there were not sufficient precautions taken. I think a good way to approach this is to look at what are a couple of the key features that are making the emergence of serious infectious diseases more frequent and potentially more severe, although more frequent is really what is the important point here. The first is we're having much more increased exposure to novel pathogens as humanity drives into tropical forest areas that have the greatest diversity of many taxa that are known to host a large number of potentially serious pathogens. Humans are being increasingly exposed to these animals and the pathogens. So when you put a logging road into a tropical forest, whether it be the Congo or Borneo or the Amazon, you're having road workers and loggers, and after that, settlers come in with their livestock who are then interacting with novel species and their novel pathogens. So this is the first line of exposure. As people settle and as people work in these areas, they hunt for food or for the wildlife trade. And through this process, they are also increasingly exposed to these novel pathogens. So land use change, taking down forests, fragmenting them, putting farms and pastures in place, this is increasing our exposure to novel diseases, which up to this point had really been only interacting with a few indigenous people in these remote forest areas. And this intrusion into these remote areas is very rapid in the last decade or more. So there's fewer and fewer wilderness areas left on the planet. Once you have people settled in these areas, they bring in livestock. And when you have wildlife interacting with livestock, I know the veterinarians can explain this better than myself, but my understanding is that can lead to shedding of viruses, sharing, and then you have mutation occurring, and you can have novel viruses, which are sometimes facilitated by livestock that then jump into human populations. As humanity increases the consumption of meat too, this is driving a lot of livestock production in many of these natural human interfaces. So part of the issue is our increased consumption of meat as well. Another issue is when you degrade these ecosystems, often you're going to lose the top predators, the large herbivores. The larger animals tend to disappear as natural ecosystems are entered into and degraded, either through hunting or there's not enough area or habitat for them or just enough room for them to live. And when you degrade an ecosystem, sometimes this allows for certain taxa like rodents to become much more abundant. So if you remove a top predator, you can then have cascading effects so that you get an increase in certain taxa that are known to harbor a lot of potentially serious pathogens. Another major driver of these potential epidemics, outbreaks, and potentially leading to pandemics is the wildlife trade. Of course, a lot of people use wildlife for their dinner. And that's not what our real focus is in highlighting the wildlife trade as a driver of pandemics. What we're seeing is a big increase in the commercial capture and sale of wildlife for various purposes. One is for consumption in towns and then in the international trade. The other is for the pet trade and other medicinal uses, traditional medicinal uses as well. And that business the wildlife trade, both legal and illegal, has exploded in the last few decades. And so the volumes of wildlife involved in this trade are much, much greater. So again, we're being exposed to a lot of animals and a lot of new species. And because the wildlife trade is very international in scope now, it is bringing together species that have never been in the wild, ever been together. So this again offers more opportunities for pathogens to interact and mutate into new forms, potentially more serious forms. For example, if you go to the Chatuchak market in Thailand, where they have pets for sale, live pets, you can find monkeys from South America very close together with vivarids or monkeys from South Africa, and with local squirrels, all together in the same shop even. So it's a lot of novel situations. The wildlife trade also is packing together very stressed animals when they're alive, and in these close quarters, their immune systems are down. Some initial research is suggesting that as an animal moves through a wildlife trade chain, they greatly increase their viral load and their decreased ability to deal with pathogens. So it is the nature of the trade, putting a lot of animals together under stressful conditions, moving them in large distances for long periods of time. And then sometimes in these unregulated markets, you have the butchering right next to the consumption. You have interactions with feral or domestic animals in these markets as well. All of these are a mix that elevate the risks of both transmission and the transmission of serious diseases to humans. And we're also starting to farm wildlife in a much greater degree. And as you again concentrate animals, you can have opportunities, as we've seen with the mink in Denmark. You can have mutation of extant pathogens in those cases. And the wildlife trade it's huge. It's estimated to be worth about 23 billion US dollars. It involves over 7,000 species of all different taxa. Some of these taxa are of much higher risk for contributing to pandemic risk than others. Bats, primates, rodents are some of the three big ones that are of great concern. And it is global in nature, and the animals move all over and they move quickly. So if there is a serious event occurring, the transport systems are such that disease can quickly move and spread, as we've seen in the COVID-19 pandemic. In conservation, we've been identifying what are some of the more serious pathogens that we should really be thinking about solutions or actions that can be taken to diminish the risk. So we're looking at not only taxa, bats, primates, and other high-risk taxa, but we're also looking at the kinds of pathogens, which include influenzas and paramyxoviruses like Nipah and Hendra, which bats, again, are a host. Beta coronaviruses, bats, rats, primates. These are known hosts for these animals, pangolins as well. And so those three, the flus where birds are primarily the hosts, some pigs, and so on. So right now we're looking carefully at high-risk taxa. We're looking at high-risk pathogens, and we're looking at high-risk wildlife trade situations that some kind of mitigations can be applied to, or potentially banned or banned permanently if one wants to achieve a certain level of acceptable risk. So globally, those are some of the features that are really driving the pandemic risk these days. Thank you very much.
Thank you, David, for very clearly explaining that what is happening at the global scene and how these issues are being tackled globally. And surely for me and for my colleagues and to our participants, that would be quite a good bit of information to begin with. So as I said, I'm requesting our speakers to come back to any specific questions that they may have for David. But we now move on from David from Hong Kong to Abhi in India. Dr. Abhi Vanak is a senior fellow and convener of the Center for Biodiversity and Conservation at ATRI in Bangalore. He is also a DBT Wellcome Trust India Alliance Clinical and Public Health Fellow. But overall, he is an ecologist, and he was also a student at the Wildlife Institute of India and has been interested in a large number of varied things, from animal ecology to disease ecology to savanna ecosystems and wildlife in human-dominated systems. He's also the lead author of the One Health and Zoonosis component of the proposed National Mission on Biodiversity and Human Well-being. Abhi, with your experience in the country all these years, could you please tell us about the risks? These are the risks I'm talking about, the emerging and the re-emerging zoonotic diseases. What are the factors which have led to the increase in this risk? These risks have always been there. If you have animals, if you have ecosystems, these risks will be there. But what is that which has changed the magnitude of this risk, and what is the factors leading to that? And then obviously, you have been the proponent of this One Health framework in India, about which our other panelists, Madam Uma, would be talking from the ministry's perspective. But from the technical perspective, can you explain that why it is being talked about as a panacea for the kind of situation that we are in? So you have, Abhi, your 8-10 minutes of glory. So please come in. Over to you.
Thank you, Dr. Mathu, very much for that introduction. It's a great pleasure for me to join this team of panelists, and thanks to WWF for inviting me to be on it. So as Dr. David Olson gave in his introductory remarks, he gave a broader global picture of the risk of emergence of some of these pathogens that can potentially cause pandemics. Now, if you look at all the literature that and the scientists who've been working for almost 30 to 40 years now on these topics, some of the literature that David was referring to earlier, we find that there are 3 global patterns. So there's human population density, biodiversity hotspots, and the presence of livestock, the number of livestock. When we look at India, we find that all 3 of these are at the highest levels globally. So obviously we have multiple biodiversity hotspots. We of course have amongst the highest densities of humans anywhere on the globe, and we have some of the highest numbers of livestock. And all of these live cheek by jowl with each other, and therefore pose the highest risks for the emergence or re-emergence of infectious diseases. And we have quite a few of those, whether they be viral or bacterial, or vector-borne, directly transmitted, any number of these pathways that we may choose to examine. So India is definitely one of the hottest of hotspots when it comes to the risk of any of these pathogens emerging and even potentially becoming the next big pandemic. But what happens? David was referring to certain set of factors that come into play when we're talking about how something can go from a local outbreak to becoming an epidemic to then going on to become a pandemic. Transmissibility, of course, is an important factor. How does that pathogen transfer from person to person? When we talk about zoonotic diseases, that is diseases that circulate in animals and also transfer to humans, There may be direct transmission. So for example, via the airborne route or the aerosol route, as we are seeing with COVID-19, or they may be vector borne. They might come via the bite of a mosquito or a tick or a mite. Now, the pathogens that are passed airborne and have then become decoupled from the wildlife or the animal to human cycle and then transmit from human to human. So their transmission patterns become independent of the animal cycle. Those are, of course, the ones that are most dangerous to humans and then that can quickly develop into an epidemic and pandemic status. The pathogens that continue to require an animal host for transmission tend to be localized or not spread as fast as possible. Of course, in India, we have several of these outbreaks of local diseases that emerge from time to time. Things like Kyasanur forest disease that is found in the Western Ghats of India. We had a Nipah virus outbreak a few years ago that was controlled very well. So there are these occasional outbreaks that do occur, but thankfully we haven't had these very, very large scale outbreaks that have occurred. Now, one of the factors that David was talking about was the presence of livestock. In many of the industrialized countries, and including in places like China and many other places in Southeast Asia, there is a lot of intensive livestock farming. So basically you've taken breeds of livestock that are meant to produce, either grow very fast, produce lots of milk, or put on weight quickly so that they can be sent to slaughter. And these are basically models of factory farming. Now, when you have high densities of livestock like this, the chances of spillover from a wild reservoir host, and then the livestock acting as an amplifying host increases. But in India, except for poultry, most of our farming systems are extensive farming systems. So in some sense, and also we have lots of local breeds. Local breeds are generally bred to be resistant to many of the pathogens that emerge from that interface with wildlife. As these things change, as our food patterns change, these are then going to increase the risk of both our food systems becoming more susceptible to diseases, as well as us having to use more and more medicines, including the use of antibiotics, to try and control some of these outbreaks. So then you lead to another kind of problem, which is antibiotic or antimicrobial resistance in livestock, and that spilling over to humans. Our forest systems, of course, our population is still increasing. The pressure on land is continuing to increase. So our biodiversity hotspots continue to be under threat, especially from large-scale conversion for mining, conversion for dams, industrialization, and so on and so forth. So these are the factors that are going to cause some of the greatest shifts in these, or cause some of the greatest disruptions in these reservoir dynamics that we see, where we are going to see a simplification of reservoir host populations out there, which might result in an increased chance of the pathogen emerging from a wildlife host to a human. When it comes to understanding these problems, the One Health framework has been proposed. Now, the One Health framework speaks very simply to tying human health to the health of animals and to the health of the environment in general. So it sounds, and this from an Indian perspective, is already deeply embedded within our traditional systems of medicine, whether it be Ayurveda or any of the other ones. So we don't view, in fact, many of our traditional health systems don't view human health as being separate from animal health or environmental health. It is all deeply connected, which is what the One Health system aims to promote. And in India, we do need to move forward. And I'll just take a couple of minutes to mention the national mission that Dr. Mathur spoke about earlier. So the National Mission on Biodiversity and Human Well-being is, we are hoping, a platform that will really push India quickly forward, propel India quickly forward into adopting this One Health framework across all the different ministries. So it can be both from top down as well as from bottom up, where a large amount of funding is provided for people to work together, because that's the essence of One Health. We have to have multiple disciplines of people coming together to work in an interdisciplinary manner. That's the only way we can start asking some of these, or solving some of these problems, or even asking the right questions in some sense. As an example, I'll give you the case of Kyasanur forest disease, which was a mystery, but in the origin of which was a mystery, but in the 60s, an interdisciplinary team came together to solve this mystery, and we need to keep that spirit going to face some of our greatest challenges as we move forward. So I'll end there, Dr. Mathur, and if there are more questions, we can take them later. Thank you.
Thank you, Dr. Abhi, for bringing out very clearly the researcher's perspective into the issue. So what has happened so far, we had the manager's perspective from Dr. David and the researcher's perspective from Dr. Abhi. Now the time is set to move towards policy, because both research and management have to feed the policy. And we have with us in the panel none other than Dr. Praveen Malik, who is the Animal Husbandry Commissioner for the Government of India and the Chief Veterinary Officer. He is by profession a veterinary microbiologist with very special interest in infectious diseases of livestock and wild animals, including zoonosis, as well as the advocacy of the implementation of the One Health scheme. He also brings with him 28 years of experience and has led the development of some of the diagnostic and vaccines using recombinant technology for equine diseases. He has also worked as a research manager. And today I have very special interest in hearing his perspective. And these perspectives are, as we have been discussing since the last 30-40 minutes. Dr. Malik, the question is that how are livestock, wildlife, and human linked with respect to diseases and health management? What is the kind of linkage is in your perception? And what are the key drivers? Because see, unless we have a clear understanding of the drivers, we will never be able to find a solution to it. And then related to would be that what is the kind of capacity we as a country hold in animal health management? Can we, or are we in a position to predict, to prevent, to detect, to control? See, all these issues are there in the minds of both a common person on the street as well as a professional attending our debates. So we need to satisfy them. That already there is a question to Dr. David about predicting. Can we predict where the next pandemic would be? So obviously he has to be an astrologer to do that. But based on your wide experience, I'm sure you can throw some lights onto it. You can also share us that what kind of obstacles and challenges do you perceive as we go about in implementation. So a whole range of questions are there, but you have only 8 to 10 minutes to respond to that. So it's always a pleasure to hear you, but here is your 8 minutes. The time starts now, Dr. Praveen. Over to you.
Thank you, Dr. Mathur. And thank you very much, WWF India, for actually conducting this webinar series on Nature Matters. In fact, and today what they are speaking, One Planet, One Health, is the subject which I personally feel like it's my subject, and I have to be there somewhere. So thank you very much for inviting me, and special thank goes to Dr. Saket also, who has just contacted me and asked me, and immediately I said, yes, this is my subject, I'll definitely be there. In fact, a lot has already been said by Dr. David and Dr. Abhi on like how these things are linked. In fact, when we are talking about human health, we need to talk on animal health. We need to talk on the kind of linkages we have got either with livestock and the wildlife as such. As such, in India, specifically when we are talking about the Indian context, India is a mega biodiversity, you know, and we are talking about the wildlife, we are talking about all other things. In microbes also, it is the same. And then when the microbes are there, you definitely are bound to get diseases as such, like different diseases of different kinds. On one side, we need regular growth of livestock sector for basically providing the protein source or providing the food and nutritional security to the human population. And that's why when we see the kind of population we have got, it's like 1:1 with the human population. And David has already said, like, this is the second highest human population we have got in India. So we have got almost equivalent amount, number of livestock with us. It's like 535 million plus livestock plus 850 million plus poultry. So it's like 1:1 kind of ratio. And then the kind of workforce that is engaged in agriculture and livestock sector, the kind of livelihood they basically share with these sectors. So that's a kind of very intricate relationship with the livestock. And these livestock, when we are talking about agriculture and allied, naturally we need some kind of land, we need some kind of space to work on and to basically expand our activities. And that's where we come into direct interface with the wildlife. As such, when we are talking about the kind of linkages with the diseases, Abby has rightly pointed out that we are talking about reservoirs, we are talking about vectors, we are talking about the alternative hosts. Pathogens are there, but that kind of interaction allows the microbe to skip or the jump into different species, and it's very, very quick to adapt to that particular species. Once it is adapted, the microbe can grow really, really very fast beyond our imagination. And that's where if it jumps into another species where we are not even thinking about, so like you're talking about the forecasting and the kind of astrology you're talking about, yes, definitely we have to look into those kind of circumstances and situations through some simulation models, the environmental factors, the previous disease outbreak factors and all other things. So we are talking about the kind of adaptation of these pathogens into new sectors. Movement of people, animals, and disease-causing agents, the pathogens, basically all the insect vectors for that matter, which carry them, they have got the direct bearing on the epidemiology of these zoonotic diseases. And especially if the pathogens exist in wildlife. It means where we do not have a direct surveillance mechanism in the wildlife population. So we generally believe on the surveillance mechanism on the livestock, which is in direct interface with the wildlife. So it has to do more with the human behavior and modifications of the natural habitats, the expansion of human population, encroachment of the wildlife habitat, and all other things. So loss of biodiversity, habitat fragmentation, loss of natural environments, they threaten the full range of life supporting services provided by ecosystems at all levels of biodiversity, including species, genetic, and ecosystem diversity. So these are directly related to each other. The disruption of ecosystem services has direct and indirect implications for public health, and that is where we are talking about. So if I have to summarize the key drivers, basically it's not only the pathogens per se, but also the kind of hygiene practices we follow, the kind of sanitation we have got all around. So it's like we are talking about increased exposure of humans and livestock to wildlife. We are talking about high demand of animal protein. We are talking about the poor hygiene and food safety norms. Here we are definitely talking about the informal markets. Unregulated pathways like wet markets or illegal wildlife trade. David has already spoken about this. The land use changes and the climate change variability. poverty per se, like that's very, very important, though it may not be directly related. But when we are talking about Sustainable Development Goals, SDGs, probably, excuse me. So when we're talking about these things, these are the key drivers basically coming together, and then the role of the pathogen starts, and this kind of thing is there. So we definitely need one health approach in effective management of all these things. And because when we say that 2/3 of the diseases, the emerging diseases, they emerge from the animal side in humans. Or when we are talking about like how zoonosis, how many pathogens of the zoonotic importance are emerging from the animals, it's like 2/3 to 75%. So it's like we have to manage that part first so that we can ensure a healthy human population, and that cross linkages can be taken care of very easily. As far as the focus areas to strengthen these core capacities are concerned, we definitely need to understand the whole scenario in one single scene. We should not be talking about these different sectors in silos. And then once we start talking about these particular kind of systems in a single whole scenario, in a holistic approach, we can definitely control the prevent or even predict those diseases in human population. For this, establishing One Health regime is very, very important. Dr. Abhi has already spoken about that. But my point is, when we are talking about establishing One Health, it's not only the mechanism. We need a definite, very, very strong coordination mechanism between different sectors. Right now, we are talking about that these sectors should come together. This intersectoral or interdisciplinary approach should be there. Yes, definitely it has to be there. But who is there to coordinate? If you ask me, as the Animal Husbandry Commissioner, Uma Madam is sitting here from the Ministry of Environment, are we talking to each other? And we don't see anybody from the human side right here. We are talking about One Health. So who is there to coordinate? We have to have somebody who can coordinate all of us. It's not like we are just talking about setting up some institution or some body, but we have to have some kind of coordination mechanism so that we can talk of the One Health. It's not only the establishment, but the real implementation of this kind of One Health so that we can come together. Previous to 2003-04, when the avian influenza outbreaks were there was practically no coordination between these different agencies. But after that pandemic or the real pandemic of avian influenza, HPAI, we have started talking about this thing. And it's not only establishing the One Health, we have to have a policy for that. So we need a national One Health policy with a provision for establishing a unified department to steer and empower for all monitoring and decision-making kind of system. So we need the kind of virtual secretariat or something so that we start talking about these things. We need to align these policies in regional and global approach for the regional and global approaches, so that we are not talking only on Indian perspective. India per se is not different from the South Asian region. So we have to come with a regional approach. We need to establish efficient surveillance mechanism for the disease as far as the diseases are concerned in humans and animals and wildlife, and the reporting of these diseases together so that we can understand the disease occurrence or the conditions before it actually jumps into another sector. So we have to have that kind of integrated surveillance and reporting mechanism. For this, we need to train the health workforce, the animal health workforce, the wildlife force, the environment system, and the agriculture system together so that we can talk about having that kind of coordination, not at the highest level only, but at the ground level immediately. And through this, we can talk about the risk factor investigation, risk analysis, the disease prioritization, spatial analysis, and all those kind of things. Unfortunately, when we are talking about all these things, we see a wide gap between what is happening on the human side and the animal side. Probably human side is more equipped. Animal side or the livestock side is less equipped. And when it comes to the wildlife side, probably is the least equipped of all these things in understanding of these disease systems. We have a weak integration and coordination between these different sectors. We have got relatively low adoption of existing animal health surveillance system into the human side. Animal husbandry and livestock management are state subjects. This is again another parameter when we are talking about. Then we have to basically devise a mechanism where we can rope in the state mechanisms as well, so that the capacities at the state level should be strengthened, and the veterinary services veterinary service delivery capacities in the country has to be strengthened in a big way. This is very important, and for this we are talking about the manpower shortage, the veterinarians and the paraveterinarians, the kind of trainings and the bridge courses they want, the kind of refreshers they want, the issues of qualifications of the extension paraprofessionals, which can enter into the wildlife side. We need to have that kind of the services on the diagnostic side, and then the delivery side. How we can approach, we can reach to up to the last mile livestock or the wildlife sector directly. Then we are talking about the reporting of these diseases and mechanisms. So what we are talking about right now in this department is building institutional capacities, not only on the human side, but also on the animal side. Like if we can really develop the institutional capacities for epidemiological studies, we can enhance the capacities of the diagnostic systems. Our laboratories at the primary level, our laboratories at the secondary level, tertiary level laboratories on the animal side. Fortunately, we have got a wonderful system in ICR system and other things. Similarly, we have to enhance our access to the quality veterinary services. Here we are talking about the hospitals to actually become mobile and reach to the last mile livestock owner, because livestock seldom comes to the hospitals when there are issues. So we need to go to them and understand their issues and then deliver those services directly. We need to have improved disease surveillance and monitoring mechanisms which are in sync with the human sector as well. And when we are talking about the animal disease surveillance, definitely we need to cover our wildlife population as well immediately. A best example for one of the transboundary animal diseases for this matter, I can say right here, is African swine fever, which has recently entered our country from the northeast side. Probably the disease had entered through the wildlife population, but because we could not report anything in the wildlife sector, this has come to the domestic pigs and could create a havoc. And probably people in this sector understands like what animal African swine fever is. The China has the Chinese market has been totally devastated because of the presence of African swine fever over there. Similarly, COVID-19, you have already seen you have already seen these conditions, and we are already facing this kind of big pandemic, unprecedented, which nobody has even realized, and we are experiencing a specific experience for this particular generation. And the last, which I am saying, is apart from what we can do, is the engagement of the community. So we need to engage our community into this kind of system. Abby has just spoken about the issues on AMR. Definitely AMR is a big issue, but you know, like how you have to control until unless you can advocate this kind of mechanism or the solutions to this to the community at large. The antibiotics are available over the counter. The antibiotics are misused or maybe abused the way we are using. The dosage regime, the regulations, though they are there, but the implementation of those regulations are very, very important. So probably the community level engagements are very important, and these stakeholders are not only the professionals, but also the students, the drug industries, the last mile stakeholder who actually takes these pills on their own. So it means we have to engage everybody together and come up with these kind of interventions for a better solution. So thank you very much, Dr. Mathur, for giving me this opportunity. And you rightly said there are lots of things to be said and to be discussed. But you have restricted me to 8 minutes. I think I have already crossed that limit. Thank you, sir.
Thank you, Dr. Praveen. I think you made two important points that while everybody is saying that have a look at the pathogen. So yes, we need to look at the pathogen, but there are issues related to hygiene, to sanitation, to food safety. So basically what you are trying to explain that we need to look in a very integrated manner. We need to look into a holistic manner, and we need to bring everybody together. And the last point was very important, that communities have also to be put on board. It is, yes, as officers and people who work in the government, we have our own set of responsibilities. But unless the community is put on board, whether it deals with the wild animal health or the animal health, we will not be able to make headway. So we move now ahead, and we now have the fourth panelist, which is none other than a very senior professional from the forestry sector, Madam Uma Devi. She is currently the Additional Secretary in charge of biodiversity. I have no hesitation in saying that she is the last word as far as biodiversity policy is concerned in the country. And therefore, when we were looking at, when myself and Saket were talking, we thought that it would be most appropriate to get her, because she is also wearing several hats as a policy person in the ministry dealing with biodiversity. She has lots of responsibilities, but more than that, she is also responsible for what we are now calling, and you heard little bit from me and from Abhi, the National Mission for Biodiversity and Human Well-being. See, the biodiversity community is very pleased that in the 73 years of our independence, we never talked of a biodiversity mission. But now the government is talking, and under the leadership of ma'am and with support from the National Biodiversity Authority, we have this thing in place. And much before the COVID-19 came, one of the important component of this mission is the One Health. And as Dr. Abhi said, that he is from the other side responsible for that. So now we have with us a kind of a convergence, a forestry professional, and she has held up, other than our ministry, she has been at the premier Lal Bahadur Shastri Academy for Administration. And she also holds a degree, a master's degree in public policy from the George Mason University in Washington. So she is, to my mind, an appropriate policy person who has understanding of the forestry and wildlife sector. And ma'am, to you, the question is that we would like our listeners to know from you that what are the plans of the forestry sector, what are the plans of the biodiversity, and as a senior official in charge of all this, how do you think that our sector can contribute in this entire issue? So over to you, ma'am, for these responses. Thank you.
Thank you, Mr. Mathur. Thanks for your kind words. And I'm really very happy to be part of this webinar on One Health and One Planet. And thanks to WWF for giving me this opportunity. And of course, this is a very, very relevant topic to discuss as the entire world is grappling with the management of control of COVID-19 pandemic, and also contemplating the solution to avoid future pandemics. So as mentioned by my previous speakers, Dr. Abhi as well as Dr. David and Dr. Malik, there are several studies across the world which have indicated the linkages between the destruction of ecosystems and leading to biodiversity loss and exposing these wild animals carrying these zoonotic organisms to human populations and resulting in these emergence of these infectious diseases. And one of the causes have been the changes in the land use patterns, and which again has resulted in habitat destruction of the wild animals, which are reservoirs of these pathogens causing infectious diseases and exposing them to human populations. And now it has become an established fact that around 75% of the new and emerging infectious human diseases are zoonotic in nature, and out of which around 60% find their origins from the wildlife, wild animals. So as mentioned by Dr. Abby, it is becoming clear that there is a strong correlation between the density of human population, biodiversity hotspots, and the lifestyle, and thereby causing this zoonotic emergence of these zoonotic diseases. And with India, with around 18% of the world's human population and around 8% of the world's biodiversity, which is India being a mega biodiverse country, and covering around only just 2.5% of the world's geographical area, it has become, or it is becoming a hotspot for these emerging and re-emerging diseases. And therefore, it is a concern to all of us, and there is a need to take proactive steps to prevent these future pandemics. And this is the right time to devise a long-term strategy in a holistic as well as in an integrated, proactive manner through this so-called One Health initiative, taking into account the interconnections among the health of animals, human beings, and the environment in disease prevention and control measures. Therefore, through this One Health approach, which is again a multi-sectoral coordination between various departments, like the Wildlife Department, Animal Husbandry Department, Veterinary Department, Environment, Public Health, Agriculture, Department of Biotechnology, all these put together, and through an integrated approach by proactive monitoring and surveillance and controlling the disease systematically, starting with the source, that is the pathogens, animals, and also parallelly doing at the human level, and simultaneously controlling the possible pathways of transmission to human beings, and conserving biodiversity and controlling wildlife trade, we can try to avoid these outbreaks of these future pandemics. So even though a lot of progress has been achieved globally in terms of One Health initiative, this is still, and in India, it is still at a very, very premature or embryonic stage, I should say. And there has been a mention in the 12th five-year plan about talking about a strategy for disease surveillance and transmission between wildlife and human through an integrated approach. However, implementation has been very poor, and it was lacking. Since then, Government of India has taken few initiatives and using One Health initiatives, but there are several challenges at the level of implementation, as my previous speakers like Dr. Malik has already mentioned. So recently, I think last year, a Center for One Health Research was approved by ICMR in Nagpur, basically to work on the research related to One Health. And I'm happy to share that there's a mission on this One Health approach. It is actually an important component of the national mission on biodiversity and human well-being, which is one of the 8 missions launched by the Prime Minister's Scientific and Technology Advisory Council. And Ministry of Environment and Forests, which is the nodal ministry for implementation of this mission, is in the process of finalizing this mission document. And it is at present under the inter-ministerial consultations, and it got delayed because of COVID. But this mission has 2 components. The first component, it deals with the documentation, monitoring, and biodiversity management. And the second component, which has around 6 programs, out of which one of them is biodiversity and health. And the One Health initiative is part of that program. The key outcomes of this One Health initiative under this biodiversity and human well-being mission would be is to first to map the hotspots of these emerging infectious diseases in India. Also to create a national One Health platform, as mentioned by Dr. Abby. So basically to bring all the stakeholders onto one platform, and creation of network of institutions doing research on zoonotic diseases. A lot of work is already being done across the world, also in our country, and to in order to bring them together, we need to create a network of institutions. Then, as mentioned by Mr. Malik, capacity building of the scientists and the technical staff on One Health is very, very important. One Health surveillance and research. So this is also one of the components of this mission, this program. And setting up of sentinel surveillance networks across India to predict and prevent the disease. This is one of the components and one of the outcomes basically. And preparation of plans and guidelines for each sectoral partner at the state and national level. So since there has been a delay in the approval of the implementation of this project under the mission, Ministry in consultation with the Prime Minister's Scientific Advisory and Technical Council, it's in the process of launching some pilot projects in 13 districts spreading across different agroclimatical regions, as well as some aspirational districts with One Health as one of its components. And this will be dealing mostly on focusing on capacity building to begin with, of the capacity building of the government staff, the local NGOs, local communities, as mentioned by Dr. Malik. It's very, very important to first build the capacities of local communities to understand the basics of One Health approach in partnership with the Ministry of Fisheries and Animal Husbandry. Recently, another project on One Health and agroecology has been approved under Indo-German bilateral technical cooperation, which is again aiming at strengthening of integrated approaches for promotion of healthy ecosystems and, of course, healthy people. So while the government has taken a lot of these initiatives, there are still several challenges for the implementation. One such big challenge, which, as mentioned by Dr. Malik, is the Inter-Ministerial Coordination. We are all working in silos. Ministry of Environment has this mission, and then Ministry of Animal Husbandry has some programs. Ministry of Health has some programs. But the coordination is a very, very important issue. And there's a lack of legal framework or the policy framework, which Dr. Malik has mentioned. That is another big challenge to implement this One Health initiative. And so we need to integrate all these programs which are already existing, programs in the government, so that there is a sharing of the experiences and the knowledge as well, and as well as a lot of infrastructure already created under these programs. Like we are talking about the new center which is being set up at Nagpur, and also under the National Center for Disease Control, 14 states have already constituted state-level zoonotic disease management committees for inter-sectoral coordination. Some states like Punjab has already started, they have constituted district-level committees also for coordination. So with better coordination and collaboration, there should be a good beginning. And I hope for the best. And at least we have started thinking in collaboration and coordination. Thank you.
Thank you, ma'am, for explaining the position and the programs. And as you have very rightly said, that networking probably is the answer. That if different ministries and agencies are involved, and for a big country like ours, we need to network the institutions, both at the policy level, and you just said at the district level also, we need these agencies to work together. So thank you very much for explaining that. And I'm very sure that in the last 60 minutes or so, our participants have got an idea of what kind of initiatives the government of India is planning under different ministries. And now is the time for Q&A. And I have received several of these questions. My colleagues have also forwarded. David, I will go to you first because there are quite a few people have been interested in asking you. And I've tried to sum up those questions. Basically, this issue is related to factory farming because a large number of animals are produced in the factories where a large number of practices, including antibiotics and others, are used. And they also cause disease transmission. So the question people are asking you is that where should we focus more? Should we look at the factory farming or we look at the wild first, or perhaps both? So would you like to come in quickly on that?
My background's more with wildlife farming. There are certainly zoonotic disease issues related to intensive farming of domestic livestock and poultry and such. And there's a good global approach to this. I know the OIE from the UN has some global standards that have been widely adopted to help monitor and mitigate some of the risk associated with the factory farming. But at the end of the day, when you put a lot of animals together in a very crowded situation and they're under stressful conditions and you do get antibiotic resistance and such, it is increasing zoonotic risk. In the wildlife trade, they're often farming high-risk taxa, which are known to be host to some of the more serious, potentially serious pathogens. And these would be things like vivarids, like civets and raccoon dogs or canids. But those are some real serious concern taxa that they're farming. And again, they're crammed together, creating situations where the animals are stressed. There's a lot of spillover of a lot of viral shedding, and they sometimes take animals from the wild to increase the gene pool or just to increase numbers in these farms. And that's introducing novel pathogens into a situation whereby you get a great amplification and potential for mutation and recombination of pathogens in these wildlife farms. So there's a great concern associated with that. What we saw in the minks in Denmark was that they were infected probably from humans by COVID-19, and possibly because of their very concentrated situation, they had rapid mutation of COVID-19, and that subsequently jumped back to humans and was seen in a variety of populations, of human populations. So there was concern that in these wildlife farms, as COVID-19 enters the wildlife populations, you have situations of rapid genetic mutation of the viruses and potentially into a more serious form with higher lethality, more transmission, and so on. So that was the great concern there, and it is a valid concern. So I do think discouraging wildlife farming of high-risk taxa is probably a very good precautionary approach. Farming of crocodiles for leather, probably less of a concern because reptiles are not, they're associated with certain zoonotic diseases, but not those that are typically associated with major epidemics and pandemics.
Thank you, David, for that. And I think Abhi wants to chip in on this. Well, Abhi, but before you do that, there is also a question for you. See, you mentioned about the wet markets. Now, the question to you is that will closing of the wet markets lessen the risk for future pandemic outbreaks? The answer is simple, but please come in.
Thanks, Dr. Mathur. So I just want to quickly make a point also that the way these pandemics have spread has actually also been due to globalization. So it's not, the emergence event, of course, can be probably linked to wildlife trade or domestic consumption or to livestock and so on. but it's actually our globalized lifestyles and the economy, the engine of growth that the world's come to depend on, that can take a local outbreak and spread it across the world in almost no time at all. Some of the Central African countries that are not as well connected and which have had outbreaks of things like Ebola, which are in really remote regions. We haven't had pandemics of that, even though that can spread pretty quickly and cause fairly severe health consequences. So that's also something to keep in mind, is that there's also a north-south story here. With COVID-19, another classic example was that in India, COVID-19 first came into the cities via air travel. And it was only because of the kinds of conditions that were imposed that it then rapidly spread to the hinterland and to rural areas. So in some sense, it was a rich person's problem that affected some of the poorest people in India and across the world, who are now suffering the greatest consequences. So that's one part of the story that we should not forget. When it comes to wet markets, actually, it's also closely linked. Now, what is a wet market? A wet market is basically where anything that's live is also sold, or where meat products are sold, or whole animals are sold along with vegetables and other kinds of produce. India is full of wet markets. Obviously, we're not going to close these. All fish markets are wet markets. Places where poultry is sold are wet markets. Live animals are sold are potentially considered wet markets. What we need is a better regulation of them and not to shut them down. These are very different from the kinds of wet markets that we've been hearing about from Southeast Asia or from China and so on and so forth, where a lot of wildlife is also kept there. Animals captured from the wild are kept in very unhygienic conditions, which can then lead to some of these interspecies crossover of pathogens that David talked about, and where you can increase the risk of this pathogen spillover. So we don't need to shut down these markets. We just need to better regulate them, have better hygiene, have better management of some of these places, so that you don't have cross-contamination in some sense. So you're not mixing up your live animal trade with your vegetable vending, or the exposure between the body fluids of these animals to humans is reduced. So that's what we need to be concentrating on, because we also need to talk about protecting the livelihoods and the nutritional requirements of millions, if not billions, of people across the world, some of the poorest people in the world.
So thanks, Abhi, for making that clarification. I think so important for people to understand that wet markets cannot just be simply closed. They need to be better regulated. I now move on to Dr. Malik.
I had a point to make. Sorry, Dr. Just to
interrupt. Dr. Malik, one of our colleagues who is listening is saying that in Denmark, about 15 million minks from farms were culled recently due to threat on coronavirus. Now, the question to you is, how should we prepare to handle this crisis if such a thing happens to our common livestock species like sheep or goat? So what is, again, our risk preparedness is the basic question. Over to you.
Thank you, Dr. Mathur. In fact, what Abhi has said, and I personally feel this is very, very important, apart from keeping more sanitation or hygienic conditions in the wet market. I personally feel that the surveillance of the different pathogens in different settings and the traceability of the total system is also very, very important when it comes to understanding how the pathogens are moving in a population. So it's also related to the same system. When we are talking about chances or the risk of spreading of diseases like corona into our livestock population, we need to understand not only the pathogens, but also the way our livestock is basically kept. So our husbandry practices are very important to understand. Apart from what we need to have those kind of predictions, or we need to have a quick detection through our better diagnostic capabilities. and then how to prevent through our biosecure mechanisms. It means the farm biosecurities or the animal biosecurity is again very important, plus the hygiene and sanitation mechanisms, which can slightly differ from one pathogen to another. And it's also related to how the pathogens are spreading, what kind of this infectious dose is required from the pathogen to come into the animal or the human side. So it's like we have got lots of different parameters for skipping or for jumping of these pathogens from one species to another. And then we need to understand what kind of this physiology is there. Like for this, we have got specific receptors for corona. We need to understand whether the similar things are available and whether there are mutations which are changing towards through understanding these microbes more regularly. So it means like the mutations we have to understand. We need to understand our livestock. We need to understand the kind of mechanisms we have got in the livestock. So epidemiological studies, including the molecular epidemiology, is very, very important in these terms. And then understanding the concept of prevention of the diseases is also there. Right now, so far, if we focus only on corona, lots of studies have been conducted, and now papers are coming. Only mink, ferret, sometimes even cats with heavy doses are affected and showing some symptoms, but not many other animals are susceptible to corona. Over to you, sir.
Thank you, Dr. Praveen. Uma ma'am, there is a question for you. It's more in the form of an explanation. Sandesha Rayappa wants to ask you that can you please expand on your idea of building a connect between institutions and various organizations? Because when we said that we need to network, he or she wants to know that what are your ideas and how do we do this connect? So over to you.
As I mentioned, there's a lot of research, a lot of literature, a lot of work going on, a lot of programs going on in different sectors by different departments and different research institutions. So we need to have a network of these institutions to share the knowledge as well as share the literature which is available with these, they share the ideas. And so this network has to be, it should be part of this One Health initiative. So this is what I was trying to mention.
Thank you, ma'am. David, there is a generic question for you, which says that can we expand the One Health concept to a landscape level conservation?
That's a good question. And I think there's many different avenues one could pursue there. But I think it's a key point in that in many parts of the world, especially in the more natural and settled interface, people often, they can't raise livestock, so they have to depend on wildlife for protein. Like in Central Africa, many people will hunt for small antelope and some of the larger forest rats just for dinner and so on. So it's important to recognize the health and nutrition aspects of local people. People who don't have good nutrition are more susceptible to novel diseases, and so the complexities they're there in these situations. I think it behooves all of us to really ask questions about not only animal health and livestock, also human health and well-being and environmental health at the same time in any kind of conservation or development program of work. Because in that way, we won't be caught flat-footed and we'll be able to put in place more precautionary approaches that are cognizant of some of these interactions, these synergies, whether they be positive or negative. But it is a fertile ground for work. So people interested in this area can really help chart a path forward. Over.
So I think we have done with most of the questions. The other are very generic ones. It's time for me to sum up and say that in the last 1 hour or so, we have had some extremely good interventions from our panelists who brought with them diverse information and experience from domain. But before I end, may I request Saket, would you like to chip in for a few comments if you like? Saket, you're there?
Yeah, thank you very much, sir. And it was really, yeah, thank you very much, sir. It was really nice to hear on different aspects of zoonotic diseases, spread of pandemic, and One Health approach. I think all of us are being impacted by this, the present COVID pandemic, for which we were not prepared. But I think this also gives us a future, I think, preparedness for future, where we should be ready to prepare for all these pandemic to happen in future. Because as David, Abhi, Dr. Malik, and Uma ma'am has rightly said, that this is going to be, zoonotic diseases are neither new nor rare, and they are going to be there in future also. So I think everything now onwards will depend on how well prepared we are. And that was really nice to hear from all the experts about their views. Thank you very much, sir. That's what I had to say.
So I think we are right on time. It rarely happens that you can close a session sharp at 6. So I would like to thank on behalf of my authority and myself, my 4 panelists who have taken time off to come to us, and all the participants who have very actively participated. And I thank the WWF for providing an opportunity. This is an important issue. And for the last 6 to 9 months, I myself have been involved in several such webinars. But now we can see some hope with some action crystallizing. And as Uma ma'am mentioned, that it has taken some time. We were talking many years ago also about this issue. But now with this COVID-19 pandemic, the context is very well articulated. And I'm very hopeful that with the help of Dr. Praveen in the Ministry of Agriculture, with Abhi in scientific community, and with ma'am leading within the ministry, we should be able to work out if One Health approach, which is institutional in nature. See, that is the takeaway from me, that we need to move ahead. Individual interventions are fine, but ultimately what stays is the institutional one. So I once again thank you all for your time and opportunity. And with this, we close this session. Thank you so much.
Thank you, Dr. Madhu. Thank you, sir.
Thank you very much.
Thanks, everyone.
Pleasure.